We usually think older people get more of their health care covered by government programs, but for many people with a limited income, it's the other way around. More expenses and more complications in signing up for benefits. For the past few years, Mass Senior Action Council has been trying to change that with some help from the State House. To tell us about the effort are the group's executive director, Carolin Villers, and one of the members, Sarah Blakeney. Thank you both for being with us.
Thank you.
Yes, thank you.
I want to start with Carolin, because I guess the expression I keep hearing about this is that when people get to 65 years old, at least many of them fall off a cliff. What's going on with them?
Sure. We've really come to call it the senior health care cliff because I think many think of Massachusetts as being a leader in healthcare reform. And that's in large part because we have connector care programs that provide income-based coverage for individuals up to 300% of the poverty line, which is about $36,000 a year for an individual. Once you turn 65, however, once you hit 135% of the poverty line, which is about $16,000 a year, you're not eligible for assistance any longer. And so folks quite literally can lose coverage and face, the large out-of-pocket costs of Medicare.
Sarah, what was the experience like for you?
Well, this has been very hard, trying to make ends meet. Sometimes you just don't have enough money to cover your expenses. And then if you had just a little bit more, you could do by some of your personal things that you really need. And it has been very hard trying to make ends meet.
Now, for some people, expenses can mean you have some, really, serious treatment for a serious problem. But I also know as we get older, we need to have a lot of things going on to help us.
Yes, we do. And like I find it now that I'm at this age that I'm at now, it's really hard. Even though I can make it to a certain extent, but then there's so many things that I cannot afford to do like I did when I was a little younger. But I do have good friends that has helped me out a lot, and I do have a niece sometimes that will send me money, but it's not enough to meet some of the obligations that I really need to meet.
Now, I know sometimes we need a lot of visits to monitor how we're doing. Maybe we take some medications.
Yes, we
do. Do you have trouble handling that kind of expense too?
Yes, I do. Yes, I do. So many medications that I can't buy because I just don't have the funds. Even though I do have a supplement that I pay for, but there's certain things, you have to pay for out of your pocket. You have to pay a certain amount out of your pocket, and it gets hard to do that.
Carolin, what's it like for these seniors in terms of what they're missing out on and the kind of hard decisions they have to make?
Yeah, I think it's important for people to realize that the average Social Security income in Massachusetts is about $16,000 a year. So, let's look at it, for example, somebody with a monthly income of about $1,500 a month, which is very typical. They are in fact paying close to $400 a month just in healthcare premiums, not to mention co-payments and prescriptions. Yes. And that's compared to a younger counterpart that has connector care coverage paying $42 a month. So quite literally, somebody can go from $42 a month to $400 a month, or paying 3% of their income for a premium to paying 25 to 30% of their income just for premiums. And I know, Ms. Sarah, I think your prescription costs alone add up to about $125 a month.
Yes.
And that's on top of a supplement, which is $114, on top of Part B, which is $135,
That's right.
on part of Part D, which is another $42. So you can see it adds up quite quickly.
Have you ever missed taking some of your medications or put things off because of the expense?
Well, not exactly, but it's been hard to get it. But a lot of times I've had friends to give me, a little extra, and that's the way I can get it, and that's the reason I don't mistaken it because someone else will give me, just give me something, to help along. And then not only do we have to pay that, you still have to pay for your eyeglasses. You don't get paid for that. You don't get no, you have to have an insurance for that. And you have to pay for your hearing aid. And I have to pay for my hearing aid and dental. I have to pay dental out of my pocket also.
This is Being the News. We're talking with Carolin Villers and Sarah Blakeney from the Mass Senior Action Council. Carolin, what about some of the remedies? Just because I see some of the things on the list here, Medicare savings accounts, and helping with the red tape of applying for benefits too.
Right. So what we did is actually seniors like Sarah, we came together and we looked at what other states are doing. And there is a federal program called the Medicare Savings Programs that can help with the out-of-pocket costs of Medicare and help alleviate some of those premiums. Massachusetts is doing what the bare minimum of requirement by the federal government. And so, again, the eligibility is 135% of the poverty level, about $16,000 a year, whereas 14 other states, including Mississippi and Alabama, Indiana, New York, places we wouldn't necessarily think of being progressive, have actually expanded access to these programs. And so we're calling on Massachusetts to do the same. It can considerably lower the costs for seniors every month, and also gives a great access to a federal prescription benefit program that can, be valued at about $4,000 a year, and that, is available through the Social Security Administration.
And it sounds as if the help here is not coming strictly from Massachusetts. You're tapping into some revenue from the federal government for this, right?
Right. So we have been working on this proposal for 5 years, and our full proposal will bring eligibility up to 200% of the poverty line. The governor, we were very pleased, made the first step in expanding up to 165% of the federal poverty line. And for an investment of $7 million, which sounds a lot to maybe us as individuals, but it's really a small investment on the state, that $7 million will bring in over $100 million in federal prescription benefits.
Sarah, would that make any difference for you?
You bet it will. Yes, it would make a big difference. There'd be so many things that I could do with the extra help, and it'll make a change in my life. And I'm pretty sure that it will make a difference in other people that's in the same category that I'm in. Even with some people, even though sometimes I can make ends meet, but there's so many other people that cannot do it. They really have a much harder time than I do.
I have to ask you one more thing, because you have enough on your plate dealing with your medical expenses
Yes.
and visits and so on. But you've been an activist too. I mean,
Oh, yes.
why do you do that?
Because I love it, and I love the people that I deal with, that I go visit. I enjoy doing it. I feel as though I'm making a change in other people's lives, even though I am a senior. But I also go visit seniors that shut in and they can't get out and do anything. But anything that I can do to help them to make their life a little bit better, that's what I do.
And Carolin, speaking of visiting, I guess there will be some visits coming up at the State House this week?
Yes, we have about 50 of our members coming from across the state. We have a membership of about 1,200, and they will be at the State House tomorrow, calling on legislators to support the governor's proposal and also to build on it so that we can bridge the gap to affordable health care for seniors.
And of course, you've got some more details. You must have this on a website or on social media?
Sure, absolutely. The Massachusetts Senior Action Council is www.massseniораction.org.
Thank you both very much, Carolin Villers and Sarah Blakeney. Still to come, high school sports with Pat Flaherty, but first, this message.